Hello, everyone, and happy 2021. Well, this is the first week of the new year, and hope everybody is kind of figuring out what their resolutions are for the new year. So, we are going to be talking about a very interesting topic today. It's called metabolic syndrome. Metabolic syndrome, did you know this? It's a cluster of 5 different medical conditions. God bless their soul, I'm serious. Anyone who has this 5 medical conditions all lumped into one, I mean, that is, that is serious stuff. So we are going to be actually talking with Dr. Nisha Chelam, who is a board certified MD. She's certified in internal medicine, holistic medicine, integrative medicine, and she is a functional medicine doctor. So she should be joining me hopefully soon, and we can take care of the questions. I apologize. There were some technical issues that were happening, so I'm hoping that she can join me now, and we can we can talk about the questions and metabolic syndrome specifically, and how functional medicine helps with metabolic syndrome. That is the topic, guys. So I think she's able to join me. So let's just have her come, and we should be ready. So any questions you have, you're welcome to kind of put it in your chat window. But joining me is Dr. Nisha Chelam. Like I introduced her before. Here you are, Dr. Nisha. Way to go.
I am so sorry.
It's okay. It's okay. I think we're all. I'm teaching a lot of people to become Insta experts now.
Totally, yeah. I've never done an Insta live, so thank you so much.
Absolutely. So we have
and appreciate
question.
Everybody's patience. Yeah.
Yes, absolutely. So before we get to the questions, I was introducing the topic first, and I was introducing you. Dr. Nisha is MD, certified in internal medicine, holistic and functional medicine. Well, you want to say something about yourself, and then we can talk about the questions. Yeah,
sure. So I always introduce myself as a recovering physician, because one of the things that we do as physicians is we diagnose a disease connected to a drug, so we get rid of the symptoms and reduce patient suffering. But in the long run, when we're looking for quick answers for a chronic problem, we always pay more in the end. And that's how I realized that one of the things that I wanted to do was functional medicine when I got introduced to it, because my job is only 2 questions, right? Number 1 is, what does this person need in order to heal? And number 2 question is, what do they need to remove so that their body may heal? Yes. And then understanding why they have the symptoms. So for me, diabetes is not a disease, it's a symptom of an underlying problem. Hypertension is a symptom of an underlying problem. So my job as a functional medical doctor is to find out what is that underlying problem so that we can actually get to resolve the diabetes. Does that make sense?
Yeah. No, I understand. And I think some of the other, like Ayurveda also has a similar kind of principles, like what you're saying is the understand, the symptom, understand the root cause, right? That's what you're talking about. Yeah, it makes, but in Western medicine, we all know the diseases, the medical conditions. That is the difference, right? So let's come to our topic. Someone actually already had a question. They did not know what exactly is metabolic syndrome. So we are talking about how functional medicine can help with metabolic syndrome. Metabolic syndrome is what it is we're going to find out from Dr. Nisha now.
Okay. So metabolic syndrome, we're like, I always say physicians are like accountants. When you talk to an accountant, they tell you about revenue, income. It's all the same thing. Yeah. But they use different words. So metabolic syndrome is otherwise pre-diabetes, or in technical terms is insulin resistance. So all 3 of them are almost similar, but metabolic syndrome has been identified, and there are criteria that tell you whether you have metabolic syndrome or not. Now, insulin resistance is something we see on blood tests. And then pre-diabetes is like when we're looking only at the sugar. Sometimes you can have pre-diabetes because your numbers are too high, but you don't have all of the criteria for metabolic syndrome. But they're all on the same spectrum. Does that help you understand?
Yeah. But there are other things also, right? With metabolic syndrome, there's obesity, there's the BMI.
If you want me to go over the criteria of what metabolic syndrome is, we're looking at 3 out of 5 of these features you should have. Number one, a couple of them are blood tests and a couple of them are physical features. So if you have a high fasting blood sugar, that's criteria number one. Or if you have low HDL. HDL is, it's a misnomer, but the way I tell people to remember what is HDL, it's a form of cholesterol. H stands for healthy, or it's high density lipoprotein. So remember it is, if you have a low HDL, we know your cardiovascular risk is high. And then you have high triglycerides, or a higher blood pressure, or increased abdominal obesity, particularly in the midline, right?
Yeah.
It's like the specific numbers we look at in terms of centimeters or in terms of inches.
Yeah.
So if you have 3 out of those 5, you technically have metabolic syndrome. But certain communities, particularly the South Asian community, they are what we call the skinny fat people, right? They don't look obese, but they have all of the other criteria. They have the low HDL, slightly elevated blood pressure, and probably, sorry, I can't do airplane mode on this, but so they have the high blood pressure, they have high cholesterol, they may not have the obesity, and they may not necessarily fit the criteria for metabolic syndrome, but they do have what is called intra-abdominal obesity, which is visceral fat, where we cannot see it outwardly, but it is present, and we do other tests to figure that out.
Gotcha.
So yeah, so 3 out of those 5, if you have potentially metabolic syndrome. And that's why decrease of intra-abdominal fat or reducing weight is one of the things that we all struggle to do, right? Everybody wants to lose weight because you want that itself will decrease your risk for metabolic syndrome.
Got it. So a lot of things come together. Like, I mean, too many things are coming together in metabolic syndrome. So let's talk about pharmaceuticals versus the lifestyle intervention, right? I mean, you are, okay, so someone is asking a question already, how to reduce hypertension. So we are getting to the questions, we are. So I think we want to start on a general high level. Like, you studied, you're a medical doctor. So pharmaceuticals versus lifestyle intervention. Right? Which one is better, and why functional medicine? So that's what we want to start with, and then we'll come to the hypertension. But please note that this is not a medical advice. This is an educational session. So big disclaimer: we have a doctor, MD, but that doesn't mean that you take it as your personal, advice here. This is an educational session. So please.
So to talk about what is better, it all depends on when you come to the doctor. So let's say you're coming to me because for the first time in your life, you've been told you went to somebody's house and you've been told your blood sugar is not recordable on the meter. It's like very high, and your blood pressure is 180 by 100. That's not the time to be doing lifestyle changes. That is the time when medications work. Like, you got to put out the fire, and then work on what caused the fire. If that makes sense. So I tell people, you cannot just dismiss medicines. I think it should not be your only option. But it is an option when you come in a very advanced stage of the disease. Now, when you come to my office, let's say I've been seeing you for 5 years. This is your 5th year, and I suddenly see that your blood pressure is creeping up a little, your blood sugar is creeping up a little, you're gaining a little weight, you gained 10 pounds in the last 1 year. Now, in that instance, 100% the first line of therapy should be lifestyle.
I see.
Okay. But unfortunately, when people go to the regular doctors, if you look at that, you use your insurance. Insurance, if it was designed to cover health and wellness, then it will cover your yoga teacher, it'll cover your fitness trainer, it'll cover organic food, it'll cover your supplements. That's not what insurance is for. Insurance is designed for disease management. Acute disease management. Even now, like I was just talking to a patient, her deductible is 13,000, which means even if she saw me 5 times a year, she's not going to meet her deductible. Do you know what I mean? So that's why insurance, people get confused about that.
Yeah.
What you have to do, like when you go to an insurance-based doctor, what do they tell? When they see your blood pressure up, your weight up, your sugar up, they will
Yeah.
say exercise and eat healthy.
Yeah.
That's a very broad
I,
term. Like, what
that
is
people find that.
exercise?
Yeah. Yeah.
Yeah,
Yeah.
I mean, you have so many ways, different ways to exercise, so many different diets.
Correct.
What is ideal for you? And
Yeah.
this is where functional medicine comes, which is why I really love it in terms of, even though I have some basic working knowledge of Ayurveda and homeopathy,
Mm-hmm.
what functional medicine does, which has taught me to do, which I probably would have never known otherwise, is to really get the right testing. And let me explain what that means.
Mm-hmm.
It
Mm-hmm.
means I actually can tell you genetically how you're wired. Now,
Wow.
are you wired to eat a high fat diet or a low fat diet or high
Mm-hmm.
carbohydrate diet?
Mm-hmm.
What are your enzymes that work and don't work? Are you at a risk for metabolic syndrome? Are you at risk for high blood pressure?
Yeah.
And then I get to do some deep dive testing. And
Mm-hmm.
in the deep dive testing, I actually see, do you have inflammation? Is this
Mm-hmm.
like something that's happening where I have to address other things like a fatty liver? Do you have a fatty liver?
Yeah.
Do you have other hormones that are not working, like thyroid? Now,
Mm-hmm.
if your cholesterol is only going up, the LDL alone is going up, it could be a low thyroid problem.
Mm-hmm.
Can I address that? Is there something feeding into the thyroid? And then I look at your other hormones.
Mm-hmm.
I get to see, is your gut healthy? Because what people forget is our body came from an egg and a sperm.
Mm-hmm.
And
Yeah.
that's how you got your brain and your toenail. They all came from the same two
Yeah.
cells.
Yeah.
So whether you have a toenail infection or, a brain tumor,
Mm-hmm.
it's a system dysfunction. It's
Yeah.
not like the toenail infection is less important than the brain tumor. The
Mm-hmm.
toenail infection is like a whisper that tells you something is not right.
Mm-hmm.
And that's when, if you actually dig deep and see, oh, there is inflammation, there is a gut um, imbalance in your gut
Yeah.
bacteria,
Yeah.
that is what is driving your cortisol, which is driving your blood sugars. You see
Mm-hmm.
how it
Mm-hmm.
interconnects?
Yeah.
That's what functional medicine taught me to do, is to look at all of your data
Yeah.
and give you the exact guidelines. So I may put one person on a plant-based diet, on another person I would say, I need you to eat more fat. It is
Oh,
all wired in you, right? It's
got it.
not like one diet fits all, then we all wouldn't be confused so much. And that's why we have so much of confusion about
Yeah.
lifestyle. So today, the way functional medicine works, you can actually get tested to see, do you really have a risk for diabetes?
I
Do
see.
you really have a risk for hypertension? If you do, what is that risk? Is it a genetic risk, or is it something else, some other problem, like you have a fatty liver? Then
Mm-hmm.
I'm able to address those and actually treat you a little more precisely. I wouldn't say it's precision medicine,
Mm-hmm.
we've not gotten there, but
Mm-hmm.
close to precise medicine as we can get in this
Mm-hmm.
day and age. So that's
Yeah.
why I think, I feel like somebody comes in and it's a slow, gradual progression. They
Mm-hmm.
should get the functional medical labs. They should work with somebody who understands functional nutrition,
Mm-hmm.
put that together, and exercise, somebody who understands how to get health back. And
Mm-hmm.
you'll find it takes really 6 months to reverse diabetes.
Wow, that's it. And people have
That's
had
it.
diabetes for their lives. I mean, especially in South Asian community, it is becoming
Yeah.
rampant, right?
Yeah. That's true. That's true. And in fact, I think I had a patient who was diagnosed, I don't know, maybe 9 years ago, never seen the 90-day average of your blood sugars should be between 4.8 and 5.2. She
Okay.
was in 13 when she was diagnosed.
Oh my God.
She's never been able to hit below 9. She worked with us, like, I think in 6 weeks, it was down to 6.25. And it'll be like another few months, she will be completely reversed. And
Mm-hmm.
that's the beauty of understanding how you're wired, what is your gut having,
Mm-hmm.
what is the change you need to do, what is a real diet you should be on, and what is the exercise, when do you introduce exercise. It's just a very fascinating journey to wellness. It's
Mm-hmm.
a very slow and a mindless journey to disease,
Mm-hmm.
but wellness is a very thoughtful, planned process, so you get results much faster.
No, I think it's fascinating. So it would be the way you were describing it's personalized precision medicine. That's obviously based on science and research because you're doing all the testing. And based on what my labs are, what someone else's labs are, you're going to prescribe different things, different type of diets that I am probably used to versus someone else. And that goes along with that, right?
And you also you'll also have to look at where you're like if you're of South Asian origin and somebody else is of coming from Germany. I can't tell my German patient, oh, I need you to eat lentils and rice. That's not going to fly. So I have to see where are they coming from, what is the health food, because every culture has their own health food. You know, we as human beings, we modify it, make food more entertaining for us, but you go back to your roots. But you have to just make some changes when you have a disease process. There will be initially some changes that are new, and as you evolve, you get to know what your body responds to. The problem is people come when they have disease, they have so much of inflammation, nothing seems to make a difference. You know, they'll go off sugar for 2 weeks, they'll go off gluten for 2 weeks, they'll go off dairy, and they'll say, I don't think anything made a difference. My sugar just kept climbing. And every time I exercise, my sugar goes up. That's because you got to get rid of the fire, the inflammation first, and then get it like, it's almost like the chaos has to be
the chaos in your body.
The metabolic chaos has to be totally understood first. You got to know the problem. And number two, there is a specific sequence in which you address it. So somebody changes their diet, but they don't have digestive enzymes. They have a terrible gut. It doesn't matter how good your diet is. Your body is not assimilating that nutrition. You understand? So that's why we've got to first address the fire, the chaos, and then create a plan. And so when most of us get educated in Google University, you think it's very simple. I can do the keto diet, or I can do the vegan diet, and then nothing changes, and you say, oh, this doesn't work for me. No, it's not that it doesn't work for you. Your body's not ready to receive that particular solution at this point in time. Does that make sense?
Yeah. So that brings me to a very interesting question. I think what you're saying is completely makes sense. You know, you got to get the fire, right? You get the inflammation out. So Ayurveda, you know how it has a concept of detoxification as well, and they talk about panchkarma, right? The panchkarma therapy. So let's talk in the same way. You know, they talk about 5 different therapies that will help the inflammation out. So in functional medicine, is there some kind of a protocol that you have or you use to like a panchkarma, so to speak, analogy that I'm giving, right?
I have the 5 pillars, right?
Yeah, exactly. So functional medicine also has something like that people.
So if you talk to some functional medical doctors, they'll say everything begins in the gut. And I actually subscribe to the science behind the health of the liver for metabolic syndrome. So the liver and the gut, I mean, the body is really designed beautifully. Your brain is in a skull. No one ever gets to see it. We just guess everything about the brain, right? We're guessing you have depression. You're guessing you have anxiety. We don't know what's going on in the brain. But the brain is connected to your gut. And whatever is going on in your gut is going to happen in your brain, right? You're constipated. You have like a brain fog. Things don't work. You have diarrhea. You have anxiety. I mean, they're connected in many ways. And we all hear that, you know, your antidepressant, like your neurotransmitters, dopamine, serotonin, most of it is in the gut. We hear about the nerve endings being in the gut. You get that butterfly sensation like I had when I couldn't get on the Insta Live. That tells me, like, you know, oh my God, that's something I'm doing is not right, right? That kind of a thing happens in the gut. It's going on in your brain. But the beauty of the body is the gut can renew every day, which means you can impact your brain within 72 hours. You chop the liver within 36 hours, it regrows. So why is that? Why is the body designed that way? Because these are the 2 main detoxification organs, number 1. Number 2, the gut is the way you get stuff into your body. right? Everything has to come through the gut. Of course, you breathe air, the lungs just do the particles. You
Yeah.
get more disease, I think, through your lungs. However, the gut gets all of your nutrients. It processes all of your toxins. It processes a lot of the bacteria, processes a lot of your hormones. The liver processes a lot of your hormones. So if those two organs are healthy, the chances are you will not have a health problem.
Wow.
So I so much focus in my so the first pillar is cleaning out the gut
Okay.
and building the liver. That's pillar number one.
Yeah.
Then I nourish the body. I don't start off with the diet, because you start with the diet with a gut that's broken, it doesn't matter.
Yeah.
Then we go to the diet. The diet should be such that your 5-year-old child can tell you what you should eat. It should not be anything complex. How many grams of carbohydrates? What kind of protein? None of that. It should be very simple principles, and then you get to change that.
Yeah.
The next part of it is, I love to talk about fitness, but before you go to fitness, if you have a hormone problem, like your stress is not handled, your cortisol is out of control, if you exercise, you will actually gain weight. So I look at the hormone health. Some people run, right? They run for, I've seen them work in the gym for 2 hours and they're gaining weight. It's because the body is sensing stress. So you have to balance the hormones. And then you talk about the fitness. And the last one, not the least, but the last pillar is, that's when patients are open up and they're willing to talk about their life of stress. Then you address the stressor and see, oh, what is the stress that's driving all these things? Because cortisol damages your gut. It increases your blood sugar, increases your blood pressure. If you don't address that part of it, nothing else is going to work. Does that make sense?
Yeah.
So those are my 5 stages that I go through. But ultimately in functional medicine, no matter what you address, the center is what they call the emotions, your feelings, your emotions, your experience. The way I put it, as long as you guys don't mind French, is beliefs, biases, and bullshit, right? So the belief is what you are raised, how you were raised. Bias is your experience in life, what you've experienced. And the bullshit is the story you attach to those experiences. Oh, I did keto diet and I gained weight, so I'm not going to do it again. But, it's like, so we weave these stories that we cannot do it, and we're stuck. And we don't realize that. And how you do one thing is how you do everything. So if you're stuck in life with your relationship, with your finances, with your health, it's the belief, biases, and bullshit. So we address that a lot.
That's amazing.
Yeah. So when people come to us, I think they're already ready. They've made health a priority.
Okay.
Because I tell people, you work with a functional medical doctor for a finite period. It's not like you come to my practice and for the rest of my life and your life, I'm fixing your diabetes. In 90 days, I get you on the right track. I change the trajectory of your health, and then you go for the home run after that.
That's beautiful. Amazing. Someone had a question about the stress. I think, how to get rid of the stress. I don't know if you want to comment. Well, someone said yes, amazing. So thank you. Someone is paying attention, so I'm super excited.
So getting rid of stress, when you really, this is something I do. Another part of my life is I love to do jail medicine. So I see a lot of young kids, how they get into addiction, right?
Oh, wow.
Yeah. So stress, if you really look what stress is, it's our own mind telling you, how things, it's called, Dr. Amen, who does a lot of brain work, he talks about it as it's called ANDS, automatic negative thoughts, right? It's automatic negative thoughts. If you just sit there, you're constantly thinking about all the bad things. So you have to make an effort every day to get a positive thought and a positive action in your life. So that is effort. So living a life above mediocrity of great excellence requires, number one, the desire to do that, and number two, daily effort. Sitting back and just, doing hoping like you will get healthy, sitting back and hoping you'll get wealthy, or sitting at home and saying, I'll dress up when I find the right person, but I'm going to be like frumpy at home, does not get us anywhere. So whatever you want, you got to plan for it, and you really need to act with intention. So stress is something we get because we are mindless. We're doing things mindlessly. We stay in a job way too long. That is, you get a paycheck every 2 weeks or once a month or whatever it may be, but you're killing yourself for that. And you realize your health is getting lost, your family life is gone. And then when you're 65, the greatest regret is, why didn't I leave that job and do something different, right? So we sit in relationships that don't inspire us, they expire us. We do these things because we're very afraid of change. So one of the things I would say, the minute you're stressed, take a step back and see what is driving the stress. Is it your reaction to the situation, or is it the situation, right? If it is a situation you can change, it's very easy to get rid of stress. But if it's your reaction, then you need some help. How you've been, again, your belief, biases, and bullshit. You address that with a coach or with a psychologist, and that's how you work through things. But people live in stress. I mean, women come to me in their 50s, and the amount of things I have to unpack when they're in their 50s is like 2 decades of the 3 Ds in their head. And that takes a long time. So I always tell people, if you're stressed, address it. Sit down and see, why are you stressed? What can you do to shift that?
Beautiful. No, someone made a point as well. I think what you say makes so much sense. And the way you're describing it's very simple, and we don't think like that. We keep, like you were saying, we keep going in a rut and thinking that, I'm scared to make a change. But the trick is to really look at your life, like you were suggesting, on a daily basis, and whether that's fulfilling or not, whatever you're doing, right? Whatever you're doing.
Yeah, absolutely. And I think there was a question about how do you get rid of hypertension, right?
Yes.
So I have, here's the thing. Most people believe it's high salt. The most common reason for high blood pressure is underlying insulin resistance.
I see.
And what insulin resistance is, insulin is the hormone. Its only job is to stock the glucose, stock your energy. So the minute you eat, glucose comes, it takes it to the cells for energy production. But if the cell is already full, it says, you know what? You ate the last meal like a whole down pizza. I still have it inside. I haven't burnt it. I don't want it. Then the insulin's job is, where do I get this glucose? Where do I put it? So it takes it to the liver. It says, okay, you're in a good place. Let me stock you here. Now, liver usually will take it. But if liver is full too, you have a fatty liver, it's full, then it takes it to the muscle. The muscle says, I'm full. You haven't used me in days. So I have all the glycogen and fat, so I'm not taking it. So this glucose is floating around. And so the insulin says, what do I do with this? And so I find that's when cortisol comes to the help. It says, okay, we are having stress now. Let's create some fat buckets and put all this glucose and convert it to fat. So we'll have this energy for later. So slowly you begin to build that fat. So this is where you find a lot of people say, oh, I'm obese, but I don't have diabetes. That's because your body is so good at making fat that your sugar is not floating in the blood. So I think this is where, and that will drive up your blood pressure. So salt is important, but insulin resistance is one of the most common and ignored reasons why people's blood pressure goes up.
People don't understand insulin resistance the way you're explaining it. I mean, people just talk about, my blood sugar up or something, but I don't think most of us understand the insulin resistance.
Yeah. And that's why your cells are resisting. It's because you have too much energy. So it says, I don't want it. So that's when I tell people, how do you empty the liver? You fast. How do you empty the muscle? You exercise, particularly strength training. That is the cornerstone for treatment of diabetes.
Got it.
Is you give that rest to your body. Don't eat all the way up to bedtime, and don't wake up in the morning and go running for food. right? Give that gap for your gut, let the liver completely empty, and then go for a walk, and then you break your fast. And you'll find that, you know, the sugar will begin to eventually come down. And always check. I really want to move people away from checking weight and BMI. You want to look at your fat content, right? How much of fat do you have? Women need to have less than 22%. Men need to have less than 16%. Most of us are running around with 33, 36% of fat, right?
Oh my God.
That is the bigger problem.
Okay.
And when we remember, we are living in an abundant world. We are suffering diseases of abundance. These are not diseases of undernourishment, but yet your cells are undernourished because they're not getting new energy, because they can't burn the old energy because of our lifestyle. So lifestyle is always a cornerstone. It's not, exercise is not an option. It is a must. And neither is giving a gap. You know, people say, oh, I don't want to fast. Like, just stop eating after dinner. That's it. And break your fast. Try an 8-hour fast. That's all you need to do. And then try 11-hour fast. Then you can try, you just go slow till you get to the point where food is only nourishing your body. It's not, so food can be entertainment, nourishment, or addiction, right?
Yes.
You don't want entertainment every day. Entertainment once in a while. It's not like, you know, you got to lead this perfect life, but you can have entertainment once in a while. But mostly it should nourish. If it's not nourishing, it's feeding your disease. So look at food a little differently. It should not be something that you do mindlessly. You really want to focus on, eat it with intention. Everything in life has to be with intention, right? You're doing something because there is an intention behind it, and things actually work out well.
I think beautiful, absolutely gorgeous and beautiful the way you're explaining it. And I can see the hearts going up, and people, you know, people are, see the claps are happening. So a very engaging audience. So I think it's amazing the way you've described it in a very simple way. You know, these sessions, we should try to keep it small so that, you know, respect your time. But we would love to have you come back and do some other topic and maybe some programs that we can offer through Dr. Nisha. But so someone said plans. Yes, we are coming up with plans and programs soon. So we will keep all of you updated. Any last comments you'd like to add, Dr. Nisha, before we wrap up?
No, I think just make intentions and visions for your health. And you can always go to my website to get more about, you know, what we do for diabetes. There is a fasting workshop that you can actually join. It's always available. It'll help you at least understand. And there's something called the Sugar Drop Challenge. They can do either of those. Those are very useful, and they will, you know, open your eyes to a very different approach.
Well, thank you so much. Someone just commenting, really, this is from my heart. Well, thank you. Thank you so much. So with that, we'd like to end this session now. And any comments anyone has who's watching, you know how to get hold of us. You see us every day doing some on different topic. I'd like to thank Dr. Nisha for being with us and educating us and really opening our eyes. Okay, so someone said, thank you. You guys help us a lot. Thank you for using Instagram. Somebody's saying like that. I'm just reading what is happening right now. I'm super excited. Guys, any other comments, you can put it in our comments. But I like to end the session now with all of us. Thank you. Bye-bye.
Yeah.